Hi, my name is Kylie, and I am a nurse and a nurse educator in a hospital. And all this week, I had the privilege of working alongside frontline nurses looking at how we can optimize the use of personal protective equipment to best protect ourselves during this COVID-19 pandemic. What you're hearing in the news is true. There is a shortage of personal protective equipment for healthcare workers who are caring for patients in any type of isolation precaution, including COVID-19 suspected or confirmed isolation. I've been seeing on social media, seeing on the news, and I've actually been asked about if it's safe to wear homemade face masks and homemade face shields. And people are making these for us. There are volunteers making face masks and face shields for hospitals and clinics and long-term care facilities. And that's so welcomed. Thank you so much for that commitment to the health of healthcare workers. So keep those coming. But one thing I will say is that is so contrary. Wearing a homemade mask is so contrary to everything that we've ever been taught as healthcare professionals. And so I was asked about these things, and honestly, I could have just said, no, it's not safe, but we're being asked to do that. The CDC is saying in this type of critical capacity situation, it's okay to do that. So I wanted to see if there really is any evidence out there on the safety of wearing a homemade face mask. So of course I started with the CDC. The CDC has been an invaluable resource for healthcare organizations, for healthcare providers, as well as just for everybody really right now. They're a great source of information. The CDC actually says in a crisis capacity like we're facing now with this shortage of PPE supplies that healthcare personnel may consider using homemade masks to care for patients with COVID-19 as a last resort. They say that homemade face masks should be used in combination with some sort of impermeable, cleanable face shield. The face shield should cover the entire face, extending below the chin and covering the sides of the face as well. And that face shield will cover the face mask to protect the face mask from any droplet particles that contain the COVID-19 virus. COVID-19, as a side note, is usually spread through the droplet method of transmission. The CDC also is saying that healthcare organizations should be addressing the use of homemade PPE types of equipment, whether it's masks or gowns or whatever. They should be addressing the potential for staff to have to use these as they're planning for their crisis capacity policies and procedures. So hopefully healthcare organizations out there, hopefully your healthcare organization is proactively considering the fact that it very well may very soon come to having to use these homemade donated PPE supplies to protect healthcare workers during this pandemic. So the CDC kind of sort of says that it is okay to wear homemade masks if your organization has made a contingency plan for it, if they've considered it within the policies and the procedures they're creating for this pandemic. So I personally think that's kind of weird that we might be wearing homemade face masks. So again, I just wanted to look and see what evidence is out there. So in looking at the literature, quite honestly, there is not a lot of recent literature out there testing the effectiveness of homemade face masks. Most of what I found seems to have come in the wake of the H1N1 pandemic about a decade ago, and these studies were done kind of as a follow-up in case of future flu pandemics. So both of the studies that I found were considering droplet methods of transmission, which is generally how flu is spread, and in most situations is how the COVID virus is spread as well. So there was one study from 2008 from Vandersand, Tunis, and Sable, and it compared the efficacy of N95 respirators compared to surgical face masks compared to homemade face masks. They did the study on lay people, both adults and children, and they did this in a non-healthcare setting. They also tested, I thought it was interesting, they tested short-term use of the masks as well as long-term use up to 3 hours of the 3 types of masks. And they also looked at outward protection, so protecting the people around the wearer of the masks from whatever droplets that they are expelling. And they also tested inward protection, so how well the mask protects the wearer from what is in the air and the environment around them. In this study, I will say there was no actual pathogen tested. They were just looking at air density when they did their various measurements. The study by Vandersand and colleagues found that all 3 of the masks do offer some protection for both children and adults by decreasing the inward exposure to droplets. So N95s, as you would expect, were the most effective, followed by the surgical masks, and finally the homemade masks were the least effective of the 3 levels of masks. So essentially, that tells us that the inward masks actually do provide some level of protection, but they're much less effective than those masks which are manufactured specifically for the job. The study, I thought it was interesting, said that for inward protection, long-term use up to 3 hours did not significantly change the protective factors of any of the 3 masks. Again, that kind of goes against everything that we've learned in healthcare, but they did find that in their study. I thought that was quite interesting. As far as outward protection is concerned, none of the masks were as effective at outward protection as they were for inward protection, but again, they were all 3 better than wearing no mask at all. There was another study that I looked at by Davis and colleagues. It's from 2013, and it looked at the effectiveness of homemade masks in a flu pandemic. So again, flu is generally spread by the droplet method of transmission, just like COVID-19 is. So it's a comparable test in that way. So the investigators in this Davies study had 21 people make face masks out of cotton t-shirts and that they had at home, and they compared the effectiveness of those cotton t-shirt masks to surgical masks, as well as not wearing any mask at all. So it's important to note that this study was specifically for outward transmission. So the mask wearer was infected with the flu, or theoretically infected with the flu, and the test was to see if these homemade cotton t-shirt masks did any good protecting the air around them and the environment around them from their droplet-borne pathogen. So the study isn't exactly what I was looking at as far as protecting healthcare workers from a patient's illness, but perhaps this study could speak to, maybe healthcare workers don't wear the homemade masks, but maybe we use the homemade masks for patients, and try to conserve the manufactured healthcare grade masks for the workers as much as we can. So the study by Davies found that both masks, both the homemade masks and the surgical masks, significantly reduced the number of microorganisms compared to not wearing any mask at all. But the surgical mask was 3 times more effective in blocking the outward disease transmission than the homemade mask was. So the authors in this study concluded, similar to the other one, as well as similar to the CDC, that a homemade mask is better than nothing, but it should be considered only as a last resort to protect against these droplet-borne illnesses. So my conclusion, after reading these 2 studies as well as what the CDC has put out for us, is that if it comes to this, and it probably will sooner than we would hope for, is that healthcare workers, we should definitely use these homemade levels of PPE that are provided for us. But if we do have to wear these homemade masks, definitely wear them with the face shield that covers the entire face. so that the droplets that are expelled into the air from the patients with suspected or confirmed COVID-19, so that they don't hit the mask directly, that they'll hit that face shield, and we can clean that off and reuse that, and in that way we can continue to reuse that homemade face mask. So if you are feeling compelled during your social isolation at home, if you're feeling compelled to volunteer to make face masks or face shields for your local hospital or doctor's office or nursing home, please do so. Again, that is an amazing thing, trying to help support healthcare workers and patients in that way. I have posted on my Facebook page how-to videos. One is from St. Joe's Hospital in Ann Arbor, Michigan, and they have a how-to video of assembling the face shields from like a transparency mask and using elastic and some sort of foam protection for the top of the mask. There's also for assembling a homemade face mask. There is a video from Deaconess Hospital in Indiana that I've also posted on my Facebook page. If you do want to volunteer to make a mask or make a face shield, consider how you can make both of them or partner with a friend to try to make both of them, again, because that's going to offer your friends in the healthcare industry even better level of protection during this pandemic that we're experiencing. Also, another thing you could do for your friends in the healthcare industry is just to say thank you. This is a really scary time for everyone, especially those people on the front lines trying their best to help patients, but also trying their best to protect themselves and protect their families that they want to go home to every night after a long, exhausting 12-hour shift. So please say thank you to a healthcare worker today and every day, because any little ray of light and sunshine and encouragement that we can get, we really appreciate it and really need it right now. Thanks for your time.